Hello, so good morning. So these are very desperate times. So I hope every one of you are safe and sound. Stay safe, stay at home, and take care of you and your family. So today we are going to start about, we are going to discuss about bacterial meningitis. Okay. So this class has been given to me as a tutorial class. It has been taken earlier for a single batch, I think. So 2 batch, they have not done this class. So let's get started, okay? So meningitis is basically the inflammation of your meninges which surrounds the brain and the spinal cord. Now this meninges is composed of 3 layers. There's first one is your pia mater, then arachnoid, and then dura mater. So precisely meningitis is the infection of subarachnoid space, which consists of only arachnoid and the pia mater, and it does not consist of the dura mater. Okay, so now we come to types of meningitis and their causative agents. Okay, so based on the leukocytes or the WBCs, it is divided into 2: pyogenic meningitis and aseptic meningitis. So in pyogenic meningitis, we see elevated polymorphonuclear cells, which are nothing but granulocytes. So all the WBCs which have granules in them, which includes your neutrophil, basophil, and eosinophil, is going to be elevated in case of pyogenic meningitis. So let me just draw a neutrophil here for your reference. Okay, so like rough diagram. So it will contain granules. Okay, now the other one is your aseptic meningitis, where you will see elevated lymphocytes. Now lymphocytes is a granulocyte. There are 2 agranulocytes, lymphocytes and monocytes. So lymphocytes will be elevated here, okay, which will not have any granules. The other differentiating factor is pyogenic meningitis is only caused by bacterial agents. Okay, and aseptic meningitis can be caused by bacterial agents, viral agents, fungal agents, and parasites. Okay, so Streptococcus pneumoniae is the most common cause of pyogenic meningitis. Okay, Streptococcus pneumoniae was gram-positive diplococci. Okay, lanceolate-shaped diplococci. Now here aseptic meningitis is written. Now this aseptic word is now considered as a misnomer. Okay, earlier it was considered like aseptic meningitis was only caused by viral agents. So if virus is causing a disease, there will be no trace of it in the blood. So that's why it was known as aseptic meningitis. Now also if meningitis is caused by only a virus, it will be termed as aseptic meningitis. But now in recent times, due to the development of techniques like PCR and other new molecular techniques, we know that meningitis is also caused by other etiological agents like fungi, parasites, and tuberculosis. So this is considered as a misnomer. Okay. Now this is the picture of pyogenic meningitis. You can see pus accumulated in here. Okay. And now we come to the causative agents of pyogenic meningitis. Now it is divided into according to the age groups. Okay, so neonates and infants, the age group of 0 to 2 months. So neonatal meningitis is known as. Okay, so it is caused by E. coli. The most common causes are E. coli, group B Streptococcus or Streptococcus agalactiae, then Klebsiella pneumoniae and Listeria monocytogenes. Okay, now the second age group is 2 to 20 years. So there the common causes will be Neisseria meningitis, Haemophilus influenza, and your Streptococcus pneumoniae. Then adults, the most common will be Streptococcus pneumoniae, followed by Haemophilus influenza, then Neisseria meningitis. So overall, the most common agent will be Streptococcus pneumoniae. Okay. Now this again is a picture of meningitis. Now the only difference between pyogenic and aseptic meningitis is earlier we talked about is in case of pyogenic meningitis there will be a elevation in P polymorphonuclear cells, while in aseptic there will be increase in lymphocytes. Okay, and the other one was the pyogenic was caused by bacteria, while aseptic meningitis was caused by all. Okay. So this is also, this image can also be given for pyogenic meningitis. So there is no difference in this image, like to differentiate. Through this image, you can't differentiate between aseptic and pyogenic meningitis. So I have just given a normal meningitis image and named it aseptic meningitis. Okay. So the causes of aseptic meningitis will be the most common cause is enterovirus. Okay, virus is the most common cause. In that enterovirus, which includes your polio, then echovirus and Coxsackie virus, followed by herpes simplex 1 and 2, and then varicella zoster virus, cytomegalovirus, and Epstein-Barr virus. Then there is myxovirus, which includes influenza A, B, parainfluenza, and mumps. Then arbovirus and adenovirus, and then rubella and HIV. Then we come to bacterial causes. Bacterial causes, first one is, most common one is Mycobacterium tuberculosis, followed by Treponema pallidum, and then Leptospira. Then in parasites, we have Naegleria, most commonly Fowleri, and then Acanthamoeba, and then Toxoplasma gondii. And in fungus, only one is there, Cryptococcus neoformans. Okay. Now we come to route of infection. So the most common route of infection is hematogenous infection. So the bacteria is there, it will pass through your choroid plexus or the blood vessels in the brain, and then enter the meninges. Meninges like subarachnoid space, only the pia mater and the arachnoid. Okay, then there is direct spread from infective side. So suppose there is an infection in my ear. So there is otitis media, or there is an infection in the sinusitis. So these two regions are very close to the meninges. So so from there, bacteria can directly enter the meninges, causing meningitis. Okay. Then anatomical defects in the central nervous system. So it may occur due to the result of surgery, trauma, congenital defects. So there will be an anatomical defect. Okay, due to which central nervous system will be weakened, and then the organism may enter there. Okay. Then the least common route will be your direct intraneural spread along the nerves. Okay. It is seen in rabies virus and herpes simplex virus infections. Okay. Now we come to predisposing factors. So in predisposing factors, the first one will be age. So in neonates, normally as everyone knows it, neonates will have immature immune system. They will have not that much well developed blood-brain barrier, and then through the mother's birth canal, some organism can directly enter the infants. So those organisms will be Listeria and group B Streptococcus. So these are the predisposing factors due to which neonates are more susceptible to having meningitis. Okay. Then vaccination. So if an individual is vaccinated to a particular organism, the disease caused by that particular organism won't happen in that individual. Okay. So suppose if a person is giving a Hib vaccine, so he will be immune to Haemophilus influenza. So Haemophilus influenza will be incapable of causing disease in that patient, of causing meningitis in that patient. Okay. Now there are factors that promote infection at primary sites. So now respiratory tract, suppose, is a very primary site of all the infections. So most of them, including now this COVID-19, so through respiratory tract only it is entering. So the factors which increase the likelihood of respiratory infection will also increase the likelihood of meningitis. Okay. So these factors include alcoholism, diabetes, immunosuppression, splenectomy, and so on. Okay. Now, presence of CSF shunt. So if there is a shunt in the CSF, so again, this bacteria or virus can directly enter into the meninges. Okay, so that is also a predisposing factor. Now there is a breach in the blood-brain barrier. Now, blood-brain barrier. Okay, so if there are some tight junctions in the blood-brain barriers. So blood-brain barrier is, if there is a loss of capillary integrity, then these tight junctions will be disrupted. Okay, once these tight junctions are disrupted, bacteria can easily cross it. Okay, So this will be the first point. Then there will be transport within circulatory phagocytes. So if there is this vessel, if there is bacteria here, some phagocyte, it is phagocytosed by some circulatory phagocytes. This circulatory phagocyte is ultimately going to cross the blood-brain barrier and enter the brain, causing meningitis. Okay. Then the last one will be crossing endothelial cell by transport within the endothelial cell vacuoles. Okay. So this and this point is the same thing, same process is happening. Just here circulatory pathogens, phagocytes are there, and here endothelial cell vacuoles, they act as a medium of transport. Okay. Now there are again virulence factor of some bacteria. So first one will be capsular polysaccharides, lipoic acid, and IgA protease. Now these capsular polysaccharides is also used to detect antigen detection, used for antigen detection in the serodiagnosis of meningitis. We will talk about that later. Okay. Now we come to clinical manifestations. So in clinical manifestations, we talk about two things, symptoms and signs. So first we are going to talk about symptom. So symptom will be high grade fever, vomiting, intense headache and photophobia, which is intolerance to bright light. And the signs will be, first there will be neck rigidity, then there is a thing known as Kernick's sign. In Kernick's signs, what happens? There will be stiffness in your hamstring. Okay, so if a person is lying down and his hip is raised to a 90-degree angle, he will not be able to flex his knees. Okay, and then there is Brudzinski's sign, where there is stiffness in the neck. If a person is lying down, he lifts his neck up, automatically his knees is going to flex. Okay, so these are some signs. So here, as you can see, a patient is lying down and his hips are flexed to 90-degree angle. Now he is unable to lift his knees because there is a rigidity here. And then there is neck rigidity here. So if a person is lifting his neck, then automatically his knees are also getting lifted. Okay, so this one is known as Kernick's sign and this is Brudzinski's sign. And then now we come to lab diagnosis. So meningitis, as we all know, meningitis, the most ideal sample will be CSF sample, followed by blood sample for culture, serum sample for antigen antibody detection, and urine for antigen detection. Now, how will you collect this CSF? So CSF is collected through lumbar puncture. It has to be done aseptically. Okay, between L4 and L5 lumbar vertebra, there should be a puncture through which CSF is pulled out. Okay, now there is 3 sterile containers should be used for it. So in the first container, we will use it for doing cell count. The second one, we will use it for doing biochemical analysis. And the third one, we will use for doing bacteriological examination. Okay, and if CSF transport, so CSF is considered as a very precious sample. Okay, so as soon as it comes, we have to process it. But if in case there is some delay, we can always incubate it at 37 degrees centigrade. Okay. Now we come to biochemical analysis. So this is the most important lab diagnosis which we do. So biochemical analysis, we look for, first we look for cell count, then we look for the amount of glucose concentration, then protein concentration and the pressure, CSF pressure. Okay, and through this only we can differentiate between your pyogenic meningitis and aseptic meningitis. And in aseptic meningitis, we can again differentiate it into tuberculosis meningitis and viral meningitis. Okay, so it would have been nice if I could have drawn a table. Okay, so let's just this is your pyogenic. First let's talk about normal level, and then this is your pyogenic, this is your TB caused by TB, and this is your viral causative agent. So first we are going to look about the cell count. Okay, cell count. Then we are going to talk about your protein concentration. then your glucose concentration, and then your pressure. Okay, so normal cell count will be, there is in normal CSF there is no RBC, only WBC is present. There will be 5 WBC per cubic millimeter. Okay, in case of pyogenic meningitis, this number increases to 1000 WBCs per microliter. Okay, and most of 95% of them will be neutrophils. Okay, because it is pyogenic. Okay, and these two are your aseptic meningitis. So here neutrophils are not going to increase. Here lymphocytes are going to increase. So in both the cases, lymphocytes are high. Okay, and the protein content, normal protein content is 15 to 45 microgram per deciliter. Okay, in case of pyogenic meningitis, there is a slight increase. In case of tuberculosis, there is a very much increase. So protein concentration in case of pyogenic meningitis, there is a slight increase. In case of TB, tuberculosis meningitis, there will be a markedly increase in protein concentration, and in case of viral meningitis, it will be normal. Okay, glucose concentration normal is 45 to 80 milligram per deciliter. In case of pyogenic, there will be markedly decrease in the concentration. In TB, there will be a slight decrease, and in viral, this will be again normal. And pressure is measured as in millimeter of mercury. So 8 to 15 millimeter of mercury is the pressure when the patient is lying down. When the patient is sitting, this is bound to increase. Okay, so this is the normal thing. It increases in case of pyogenic meningitis very much. It increases moderately in case of TB, and it increases very slightly in case of your viral meningitis. Okay. Okay, now here everything is written in words format. So in acute pyogenic meningitis, more than 1000, as I already told, protein content is elevated, glucose is markedly decreased or even absent, CSF is highly elevated. In tuberculosis, again, there will be your slightly increase in the lymphocyte cells. There will be markedly increase in protein level, glucose level will be slightly decreased, CSF will be moderately elevated. And in viral, mild lymphocytosis is seen, then protein content is normal, glucose content normal, and CSF is mildly elevated. So this is the chart you need to remember. This chart please draw in your copies, because this is the main diagnosis, lab diagnosis of your meningitis. If a question comes on meningitis, you have to draw this, okay? Because after this, we are going to talk about this microbial examination. There you just have to name the organisms and write what they look like under the microscope. So this is the main thing for you to differentiate between the two, aseptic and pyogenic meningitis. Okay, in this, if you memorize this chart, you will now this whole class will be success. Okay, yeah. Then we come to another lab diagnosis, which is microbial examination, and in which we are going to talk about CSF microscopy. So gram staining of CSF is only done for early initiation of antimicrobial agents. Okay, so here as CSF bacterial load is very less. So normally we when we make a smear, we just take a loop. In that we take organism and then we just inoculate it and then air dry, and then we look it into the microscope. In this case, we have to repeat this procedure again and again. Once you have taken the CSF sample, you have air dried, again on top of that, again you have to take, so this is one, this again you have to take, like that. So that thing we call as heap smear. Okay, so this increases the chance of finding an organism inside the CSF. Okay, alternatively, you can perform centrifugation also. If CSF can be centrifuged and the deposit is examined for gram stain. and the supernatant we use it for antigen detection. Okay. So Streptococcus pneumoniae, the most common cause, E. coli and Neisseria meningitis. So all these three are the causative agents of pyogenic meningitis. Okay. So you can see here Streptococcus pneumoniae, it is gram-positive lanceolate shaped. Then E. coli, short stout gram-negative bacillus, and then Neisseria meningitis, which is intracellular and gram-negative diplococci. Okay. Okay. And then for the causes of aseptic meningitis, the bacterial cause was your Mycobacterium tuberculosis. For that, we are going to do acid-fast staining or Zn staining. Then there is Treponema pallidum and Leptospira. Both of them are spirochetes. Okay. And then we do Zn staining for Mycobacterium tuberculosis. As you can see, acid-fast slender beaded Mycobacterium tuberculosis is seen, and the blue ones will be pus cells. Okay. Then India ink preparation is done for identification of Cryptococcus neoformans. So Cryptococcus neoformans will look like budding yeast kind of cells, and it will be surrounded by a clear halo, which is the capsule. Okay. And then wet mount is done for parasites. So this thing is the trophocyte of Naegleria fowleri. Okay. Now we come to culture. Now in culture, we perform bacteriological culture where we use enriched media like chocolate agar and blood agar. Now since CSF, the amount of bacteria is very low, so first we have to enrich it. So to enrich it, we use enriched broth. So example of enriched broth would be brain heart infusion broth. So first we are going to inoculate the CSF sample, part of the CSF sample into the brain heart infusion broth. Then we are going to inoculate into the respective plates like chocolate agar and blood agar. Alternatively, you can take blood and directly do blood culture into blood culture bottles. Then after that, when the organism grows, you can perform biochemical test for identification of organism, followed by antimicrobial susceptibility test. Okay. So this comes under bacteriological culture. Again, you can do fungal culture by using SDA or BHIA agar, and viral culture by using appropriate cell lines. Okay, now we come to antigen detection. As I told, when you centrifuge, the supernatant will be used for detecting antigens, and the deposit will be used to do gram staining and the culture. Okay, so in antigen detection, we detect the capsular antigens for all these organisms. Okay, so from CSF we can detect Cryptococcus neoformans, Streptococcus pneumoniae, Streptococcus agalactiae, Neisseria meningitis, Haemophilus influenza. All these capsular antigens we can detect. And from urine we can detect Streptococcus pneumoniae by ICT method and Cryptococcus neoformans by latex method. Now here also everything in case of CSF was performed by latex method only. Okay. So in our lab, you have already performed latex agglutination tests and immunochromatographic tests. Okay, you should remember that. Immunochromatographic test was performed in case of dengue, and all the other tests, serological tests which we have done was latex agglutination test. Okay. So antigen detection we have done. Now antibodies can also be detected. So antibodies are only detected in case of viral infections. Okay. So herpes simplex virus infections, we look for serum antibodies. Okay. And then there is bacterial endotoxin detection. So the most prominent method used is limus lysate assay. So to detect the endotoxins for gram-negative bacteria. Suppose these are endotoxins. So there is a amoebocyte cell which is present in horseshoe crab. When this cell is mixed with the endotoxin in the patient's blood, then there will be coagulation. So this is the principle of the test. Okay. And at the end we come to molecular methods. So in molecular methods, first, if you want to detect a Mycobacterium tuberculosis in case of tubercle meningitis, you have to look for the gene known as IS 6110. So if this gene is present, by doing PCR you can find out, and if it is present, then the patient is suffering from tubercle meningitis caused by Mycobacterium tuberculosis. Okay, and for pyogenic meningitis, we perform multiplex PCR where we can detect common etiological agents like strep pneumoniae, meningococci, H. haemophilus influenza. We perform there are multiple primers which we can detect through multiplex PCR. Okay, so this sums up your bacterial meningitis chapter. Now, if a question comes on bacterial meningitis, you need not to write the causes of within aseptic meningitis. You only write the bacterial causative agent. Don't go into the details of viral, fungal, and parasites. And according to that, you have to modify the lab diagnosis also. So it is if in case this question comes, bacterial meningitis question comes, so in lab diagnosis you can choose one bacteria which you know better. It is like in case of pyogenic, you have to write on Streptococcus pneumoniae, and in case of aseptic meningitis, you can write on Mycobacterium tuberculosis, some lab diagnosis which you know. Okay, so thank you. Stay safe again.